líderes religiosos para apoyar la necesidad de una reforma del sistema de salud en este país. El sistema está roto y por eso tiene un efecto muy negativo para los pobres, los que no tienen seguros o los que no tienen suficientes seguros. Es un asunto de la dignidad del ser humano y como hombres y mujeres de fe, nuestra fe trae valores que puede tener un aporte muy positivo en este debate muy importante. Eso no quiere decir que estamos dando nuestro apoyo a una propuesta específica, pues todo está en grupo todavía. En el Senado todavía no hay una propuesta completa, pero queremos apoyar la necesidad de una reforma del modelo actual y queremos que los que están haciendo la ley en este momento, los congresistas, que hagan una propuesta que protege la vida, la dignidad y la salud de todos. Y yo añadiría desde el momento de la concepción hasta la muerte natural. Esta debe ser una prioridad nacional, pues es una imperativa moral para todos.
So what was you said when you were seated that you weren't at the mic? What was your reaction in response to the lackluster response?
We're not happy. That's a kind way of putting it. And they can still make us happy by showing up.
Bishop, can you talk about what your delegation is asking for? You know, people are complaining, well, we don't like the health care now, we're not sure that we're ready for this change. Is there something specifically that they're asking for that you would be able to represent them on?
Well, basically, we want quality, affordable, accessible health care. And that's a human right, that every human being should have access to health care. That the health care they receive should be of good quality, and third, that it should be affordable. Okay. Once we do that, then we also want, you know, from my perspective, we want the protection of conscience, so that institutions and individuals do not have to violate their conscience in providing health, what some would consider health care that would not be, in our view, health care like euthanasia or abortion services. Second, as church people, we try to be the voice of the voiceless, and in that sense, we want to make sure that the poor are not forgotten about in this debate. You know, everybody has their interest groups that are trying to push their agenda, and oftentimes the low income, the immigrant, are not taken into account, the uninsured, the underinsured, and so we want to speak out for them. And so that's the points that we're trying to make as people of faith. Again, as I said earlier, the bills in the Congress right now are in a state of flux. The House has one version, the Senate is still writing theirs. As the rabbi said, the House probably hasn't read theirs, and the other one hasn't wrote it to read it. The difficulty is, of course, there's going to be a lot of give and take. You know, making laws is like making sausages. You know, so you have to, and the devil is in the details. And so, I guess we're here a little bit to try to make sure that they listen to their better angels and not let the devil lose them in the details.
Monseñor, muchas de las personas que quedan sin cobertura en este momento son inmigrantes y están entre los más pobres de la sociedad. ¿No puede hablar un poquito sobre eso?
Sí, hay muchos inmigrantes sin cobertura y eso quiere decir a unos que son legales aquí en este país. Y yo creo que el acceso es un derecho humano, entonces debe haber caminos para todos, aunque los que son inmigrantes o que son pobres deben tener acceso a su cobertura. Porque si no, los costos son mayores, no solamente para los costos humanos, que son muy críticos, cuando uno que no puede ir al médico se pone peor o pierde su vida, pero los costos para la sociedad son grandes también, porque si ese inmigrante no va al médico porque no tiene dinero, bueno, un día va a caer en la sala de emergencia en un estado peor, y esto va a costar a todos más.
Positively to your invitation, is it fear?
I couldn't comment on their motivations. It could be that their calendars are crowded, so it would be unfair really to comment on their motivations. That's perhaps your job to ask them.
I'm President of Council News. Bishop, if the proposed government health care reform includes abortion services, is that going to be a litmus test for the Catholic Church? Will you absolutely not support the reform if that's included in the reform?
It would not be a reform if that was included. Also, not only we want to preserve the prohibition against funding of abortions that exist in the law right now, but we also want to protect our own conscience rights. 1 out of every 8 beds in this country, hospital beds in this country, is provided under Catholic auspices. So, unfortunately not here in Central Florida, but throughout the United States, Catholic healthcare is a major player in providing assistance to and access to our citizens.
That you are trying to be the voice for the voiceless, for the poor, the forgotten. I know this is a very complex issue, but how do you see that community, that population being forgotten in the bills that are currently being considered?
Well, they're being forgotten now in the present reality. But, for example, in the House version, right now, it does, the version that many of the representatives have not yet read, the House bill still discriminates against legal immigrants because it does not remove a 5-year residency requirement that people that are legal immigrants cannot access Medicaid or Medicare until they've been in the country for 5 years. So you can be legal, but you have to stay healthy for 5 years before you can get any